Have the opportunity to get to know patients in the context of their lives. So a patient isn't a diagnosis. Instead, they have their whole life story, and that affects how and when and why they want to take care of themselves. And I feel like my being able to know that and understand it, and even also in the context of the family dynamics in which someone is living, all helps me provide better care for that individual. So I've had a variety of clinical experiences so far in my career. I've worked at sort of traditional clinics. I've worked for the Indian Health Board. I've worked in Native Alaskan population. I've worked in an integrative health center with other medical doctors in addition to naturopaths, acupuncturists, mental health providers. So I've had a lot of different experiences, but I was really attracted to Q-Liance, the model, as a way of helping change healthcare and really emphasizing the relationship between the provider and the patient and giving us adequate time to develop that relationship. And I feel like that is what's missing in most clinical settings, and it's just essential to the future of healthcare, both financially and the quality of care that will be provided in this country. So one of the things I think is important about the patient-provider relationship is mutual decision making. And I don't feel like I'm here to tell people exactly what to do. I'm here to share what I've learned through my experience and through my training, and then making a decision with that person depending on their own life situation and their belief systems. So I sort of like having that dialogue of these are the things that I know of, and then hearing from the patient what are the things that they know of and what resonates with them and what is consistent with their goals, and then making the decision together, and sometimes even experimenting. Like, let's try this, and if it works, great, and if it doesn't, let's try something else. I do have an interest in alternative medicine, so I'll often suggest a wide variety of options for treatment, particularly for chronic conditions. I might suggest acupuncture, I might suggest a visit with a naturopath or a massage therapy, in addition to more traditional therapies like medications or physical therapy. Okay. One of the reasons why I've chosen Q-Liance is they've given me the opportunity and the freedom to teach classes, which I'm really excited about, and I've done some in the past. And I'm going to be teaching groups of diabetic patients, also teaching classes in nutrition, and also teaching classes for those with chronic pain conditions like back pain. And that will include not only Western medical information about back pain and the treatment of it, but also I'll include yoga movements and mindfulness meditation, which has been shown to be helpful for those suffering from pain.
I chose primary care because I enjoy taking care of the whole family, taking care of the whole patient, meeting all of their needs, seeing them when they're well, coming in for their wellness visits, doing referrals as needed, being their advocate. That's what primary care is to me. The patient-provider partnership it takes time to develop, and it's based on trust, and based on it's somebody that the patients feel comfortable with. So hopefully, I'm that provider that that patients are comfortable asking their questions and don't feel intimidated and are able to get their questions answered, when they need to, and whatever it is that they need to know to keep them healthy. The Q-Liance model of care for me is putting patients first, and that was why I chose Q-Liance, because patients are the priority, and the providers are given that opportunity to develop those relationships with patients and make them a priority. And so patients are able to have time, longer appointments, and have that time to establish their care and to have a good relationship with their provider. Previous answer. Yeah. So I chose Q-Liance because of the model of care that it has, that their philosophy of putting patients first, that patients are the priority and not the number of patients that are seen per day, was a big factor for me. I wanted to be able to provide quality care and have that time to to provide that care for the patients. So that was what I chose for why I chose Q-Liance, and that's why I enjoy working here. Q-Liance differs because having that time, the time is a big factor, and having and not being rushed, between patients, having to see one patient right after the other, and really having that time to really meet all of the patient's needs, and not, you can only have one issue per visit was a very common way that other practices are run, that they only have time to address one concern per visit. And I found that patients obviously they don't always have just one concern. There's obviously multiple concerns that that need to be addressed, and we may not be able to address all of them at one visit, but we've at least talked about them, and they're out there so that they can be brought up at future visits.
I decided to join Q-Liance so that I could practice medicine in the way that I really intended to when I graduated from medical school, which is to be able to have time with patients and really get to know them and their backgrounds and their history, and therefore be able to help them to make the best decisions for their medical care. I think what sets Q-Liance apart is the fact that we have both the resources but also the time to really be able to have that patient-provider partnership and really get to know the patients, so that then when things do come up, we can help them to determine their best treatment plan, and not just treat a problem, but treat the whole person.
Q-Liance gives providers an opportunity to have time to find out more about the patient, because each patient is just so unique culturally, and their own medical problems and ways that they solve things for themselves are so unique. So by having time to do that, I can do a more effective job. It also provides time for us to get back to patients and talk to them without them having to physically come into the office, and make sure that they understand how to take that next step to improve their health. I really enjoy the opportunity to see people of all ages. So from a baby that is 1 day old to someone who's 100 years old, and it's also exciting to sometimes be able to see people that are all in the same family, since a lot of times their health issues interrelate to each other, and I feel like we can personalize the care more with the opportunity to do that. In Q-Liance, it's really about the quality of care rather than a quota of the number of patients a day, which is exciting for me. There are other places where I've worked where there's certain numbers I'm supposed to meet or get done with a patient every 15 minutes, and there were times when I felt like I had to change the quality of care. While here, I can spend enough time with a patient. I have scheduled time to call them back. I have staff to help me get them back, and we have a great electronic medical record that helps us integrate all that so that all of us know what's going on at any time.
I chose to work in primary care because I like to take care of the whole person and offer holistic care that includes every aspect of a person, including their family life, their work life, and who they really are.
Great.
To me, a patient-provider relationship is a partnership. It's a patient and I working together to give that person the best health that they can have. It's empowering them to be able to have a healthy lifestyle. I chose to join Q-Liance because I believe in Q-Liance's philosophy of treating a whole person and having a longer appointment time so that I can get to know people and provide the best care possible. I chose primary care because I like to take care of the whole person, to offer holistic care. And I like to offer that holistic care to not only one person in a family, but the entire family, so that I can care for people from birth through old age. And when I know someone and their family, I feel like I can offer better care for that person and their entire family.